Well, hi everybody, this is Robert with Shameless Care, and today I'm going to tell you some things about STIs that are absolutely going to blow your mind. I promise you, virtually no one knows this information, but it is life-changing information. And the number one thing I want to tell you today is that if you are hyper-focused on preventing HIV, meaning if you think of HIV as like the most important STI, then it's inadvertently causing some problems. Now, first things first, we have to get a baseline understanding of what the per exposure transmission rate is of HIV. So this is straight from the CDC's website. I'm looking at it here on my phone because I do not want to get these numbers wrong, but I'm going to show it to you on your screen. Now, if 10,000 HIV negative women, cisgendered women, 10,000 of them, all HIV negative, had unprotected sex with 10,000 HIV positive men, so every man has a woman, so to speak, 10,000 HIV positive men, HIV negative women, no drug therapies involved, and they're all about to have unprotected sex. So in other words, we're going to get what the transmission rate is per 10,000 exposures. Now, if you tested all of those women 3 or 4 weeks later, plenty of time for them to test positive for HIV, how many of those 10,000 women who just had unprotected sex with an HIV positive man do you think would test positive for HIV? In other words, how many of those women could we expect to have contracted HIV from that sex? So if you think it's half, 50% transmission rate, that would be 5,000 of the women. If you think it's 30%, that's 3,000 women, so on and so forth. Well, the answer is 8. 8 out of 10,000. And that is straight from the CDC's website. That's not necessarily the point of this video, but I want to help you put things in perspective because I feel like that's really important. If those roles were reversed and it was an HIV negative cisgendered male having sex with an HIV positive cisgendered female, it would actually be half of that. It would be 4 out of 10,000. And I bet that's a heck of a lot different than what you imagined because, well, sexual education in the United States is not great, and people often have a high degree of confidence about STIs, I guess because everyone has sex. But now, unfortunately for anal sex, the transmission rate is significantly higher. For receptive anal sex, it is 138 out of 10,000. And for insertive anal sex, it's 11 out of 10,000. So there's no doubt about it, anal sex has a higher transmission rate than vaginal sex. And we have to assume that's because the tissue bleeds easier, right? Let's all just keep that in mind. Probably because that tissue bleeds easier. Now, I know what you might be thinking. You might be thinking, what's his point? Or it only takes one time. Get it? I get it. It does only take one time. Somebody could contract HIV the very first time they have sex with someone who is HIV positive. There's no doubt about it. But the reason why I told you that information is to kind of set the baseline to tell you this. If that person has another STI, then the risk more than doubles and almost triples. So for insertive vaginal sex, it goes from 4 to 10.6. For receptive, it goes from 8 to 21.2. For insertive anal sex, it goes from 11 to 29. And for receptive, it goes from 138 to 365. And that, my friends, is one of the reasons why when we think of HIV as the most important STI and everything else is just sort of fill in the blank, it really can cause a lot of significant problems. For example, trichomonas is the single most common curable STI in the United States, and I can almost be assured that every single person watching this video has never once had it included in an STI panel. Physicians, nurses, definitely for-profit companies, and free testing almost always. None of these places include trichomonas in their STI panel, and that is a huge mistake because it is extraordinarily common. People test positive for it at Shameless Care regularly, and it increases your risk of all sorts of things, one of which being an increased risk of HIV. Similar thing with Mycoplasma genitalium. It's a little bacterium, super common STI, increases your risk of all sorts of things, but one of them being an increased risk of HIV. And that is why we have to take a comprehensive look at STIs. Now, the reason why I think that people often think of HIV as the most important STI is because that explains the wild inconsistencies among STI panels that are offered from doctors, from Planned Parenthoods, from free clinics, from all of these places. They all offer different STI panels, but the one thing that is consistent is HIV. It almost seems like HIV and then just fill in the blank with some other stuff. And some of the for-profit companies have clearly just focused on a price point for their STI panel and then included the assays in that panel that helps them meet that price point. Again, they always include HIV. They know the consumers are looking for that. But in my mind, when somebody is seeking an STI test, it's because they want to know if they have a sexually transmitted infection. And for that reason, we just wouldn't offer one that didn't include things like throat swab testing for gonorrhea and chlamydia, or mycoplasma genitalium, or trichomonas. And the last thing I want to tell you about this, and if nothing else, I hope this gets through to you, is when people almost exclusively focus on things like HIV as being the dangerous STI, as being the most important STI, it kind of narrows their focus to such an extent that they forget about other things like HPV. HPV is can be very dangerous and can be deadly STI. So let's talk about HPV. HPV has about 200 different strains, most of which, so far as we know right now, are pretty harmless. And the body can typically clear itself of these strains of HPV without too much difficulty. So you might test positive if you get tested for them, but 6 months, 2 months, whatever, maybe a year, they kind of go away. And as far as we know, that's that, right? But there are some very dangerous strains of HPV, which can cause things like throat cancer, cervical cancer, genital warts, things like that. Now, the good news is that there is a great vaccine which has been extremely effective at reducing the risk from those more dangerous HPV strains. And you would be surprised how often I give talks to groups of like swingers or polyamorous people or stuff like that. And people will often say, yeah, I keep thinking about getting that HPV vaccine, but I just haven't done it yet. Now, those same people would never forget to use a condom because they're extremely concerned about HIV, even though if you look at the sexual behaviors of a lot of those people, they have very, very, very little HIV risk, but their HPV risk is extremely high. In fact, it's almost a certainty. And I know that's strong words, but that's straight from the Centers for Disease Control. The CDC says that almost everyone who is sexually active is going to contract HPV in their lifetime. And I would argue that people who are consensually non-monogamous are going to be almost continuously exposed to HPV for some reasons I'm going to get into right now. Now, one of those reasons is that testing for HPV is virtually non-existent. Now, I know if you're a cisgendered woman watching this, you've gotten pap smears and you get HPV tested at that time. But did you know that HPV testing is site-specific? So, in order to find out if you actually have HPV, if you have any anal sexual contact, you would have to have anal testing as well, and you would have to have throat testing. So it is quite possible for a woman to test negative in her pap smear and still have HPV in other parts of her body. It's very interesting, right? Now, if you're a cisgendered male, odds are you've never once been tested for HPV. And so you could have it anally, you could have it in your penis, you could have it in your throat, and you're just never going to know, right? So the testing for HPV is basically non-existent for the purposes of which we're talking about here, which is, can you really ever be sure if you have it or not? The answer is no. You just kind of have to assume that you do, and your best opportunity to take action against that is to be vaccinated. Now, the last thing I want to let you know about HPV is that it is a very strange virus when compared to other STIs. It's been called the glitter of the sexual health world. I've often heard it called the common cold of the sexual health world. A couple of interesting things about HPV is that it's very hardy. It's kind of a strange term, but it's the best term I can think of for it. There is a study that shows that there were active levels of the virus even after being on a dry surface for up to a week. That is far different than most of these infections, which become inactive almost immediately when they're outside of the human body. Up to a week. It spreads through skin-to-skin contact, which means that condoms are no safe bet against it. Might help a little bit, but if you're that close to somebody who has HPV, you're almost certainly going to be exposed to it. And the final study I want to let you know about is that there's a study out there that showed that there were detectable levels of HPV on a sex toy 24 hours after it had been thoroughly cleaned in a research setting with an alcohol-based commercial toy cleaner. So HPV is basically unavoidable. It just has everything going for it to infect almost everyone that's having sex, but vaccination is key. And again, if you're so hyper-focused on HIV, of which your risk may not even be that high depending upon your sexual behavior, that you lose track of things like HPV, which you really could take action against if you thought about it, well, that's just one more reason why I think that people are a little too focused on HIV. Now, I want to be clear here. I did not say that HIV isn't a very important disease. It obviously is. I didn't say that HIV isn't dangerous. It obviously is. I didn't say that it shouldn't be a concern of yours. It obviously should, and you should be tested for it regularly. The reason why I didn't talk a lot about the testing for HIV is, as I've said, virtually every STI test includes it, right? But what I did say is that when you hyper-focus on it, you cannot really so much concentrate on, are you being throat swab tested for gonorrhea and chlamydia? Because if not, you're not being STI tested properly. Are you being tested for trichomonas or mycoplasma genitalium? Those cause health complications on their own. They spread easily to other people, and in a weird sense of irony, can actually increase your risk of contracting HIV. And the final thing I told you, I made sure that I got the HPV vaccine as soon as I possibly could. And friend to friend, this isn't medical advice, I think it should be a priority of yours as well. So that's it. I'm Robert from Shameless Care. Thank you so much for watching, and we'll talk next time.